This is Dr. Dennis Lux, sports and regenerative medicine expert. Today we're going to talk about shoulder pain, specifically older patients who want to be extremely active. This particular patient, 65, had rotator cuff pathology resulting in his shoulder pain, and he's an obstacle course racer, which if you've ever seen the show American Gladiator or Titans, you'll see some of the stuff they do. And being 65 and having a bad shoulder, it's hard to do that when you're a young person. But he had rotator cuff pathology, which is common in lifters and people do overhead stuff, baseball players, tennis players. So we're now looking at a normal humeral head, normal architecture of the cuff here. The rotator cuff is 4 tendons that make up a supporting structure. It overlies the glenoid labrum, which is a cartilage layer over the bone. It supplies a support structure, allows your shoulder to go in extreme motions, and one of the 4 tendons, the supraspinatus, initiates abduction. When the arm is externally rotated to 90, abducted to 90 and externally rotated outwards, you place the supraspinatus tendon, which is on the greater tuberosity, close to the subacromial splice. So if you have a spur here, a lot of times it causes impingement. So in this particular one, we have an abnormal one, and the rotator cuff no longer looks nice and smooth. It's getting darkened, as in tendinosis, and we also have this fluid accumulation. So this is typical of a banged up rotator cuff that occurs in time, and we see the AC joint here. It looks a little degenerative. Sometimes you see it downsloping acromion, which is actually a spur that sticks into the supraspinatus. So when they bring their arm up, it creates quite a problem. These types are very easy when there isn't a full tear to fix with regenerative medicine stem cell therapy. We do this quite often. We've had some athletes that we've got follow-up MRIs that they're with even partial tears completely resolved. Of course, the younger the better, the less tear the better. A complete tear that's disconnected tendon, you can't make it go back together with stem cells. But we've had a lot of tremendous results with athletes, and including professional baseball players that have had failed surgery that have done well, and baseball pitchers who have labral surgery or rotator cuff surgery. A lot of them never make it back to professional baseball. It's a very hazardous injury for pitchers. About a third make it back. Some have tremendously long careers, but of the ones who make it back, they only average about 100 innings. So they don't have a long lifespan, even if they make it back to the majors. So it's a very tough injury for baseball pitchers. But we've had a couple that have gone back and got $100 million contracts. So they've done very, very well. So this guy we treated with regenerative medicine stem cells, and after appropriate time to let it heal, and we train them around their injury with a different rehabilitation program. And typically elite athletes, it's about 6 months to heal, and we got him back, and he's back to doing his obstacle courses, which he loves. Even though at 66, that's not what I would typically recommend, but we have to deal with patients who love their sports. I have another patient up here who's in his early 60s, and I've done his knee multiple times, but he's an Ironman, and that is a brutal thing. But his goal is to run every Ironman in the world, and I've done his knee multiple times because he keeps running. So the last time he came in, I said, "Tom, how many have you done?" He just got back from Europe running a couple races, and he said 20. So I asked him, "How many Ironmans are there in the world?" He said 40. So he's only halfway there. Now, obviously, that's a lot of wear and tear, but athletes sometimes want me to just patch them up and keep them going, and we try to work with the athletes. But, there are some things that are much more difficult on the joint, and so we patch them up, and we may have to see them again, but the typical patient who just wants to stay functional with easy sports do a lot better.